today's lecture is about structure of human stool. In the previous lecture, I have explained about the oral digestion that is take place inside the oral cavity of the man. This oral cavity is consist of palate, tongue, cheek and jawbone. The jawbone bears a number of teeth that are different in structure because of their function, about which I have explained you in the previous lecture. There are 32 teeth are present inside the oral cavity of man, and these teeth are divided into 4 categories: incisor, canine, premolar and molar, about which I have explained you in the previous lecture. The basic structure of these teeth are similar. Each teeth of man consists of 3 parts: crown, neck and root. Crown. Crown is the outermost part of the teeth that is present outside the gum, while the region of the teeth that is present within the gum is termed as the region of neck, while the region that is embedded within the jawbone, this region is termed as root. Crown consists of 3 parts. One is the animal, second is the dentine, and third one is the pulp. Animal. Animal is the outermost covering of the teeth that not only give the protection to the teeth but also give bright appearance to the teeth. Inside the animal, a soft structure is present which is termed as dentine, and inside the dentine, pulp is present that is consists of number of sensory nerves and blood vessels that supply nutrition and oxygen to the growing teeth. After that, some region is present in the gums that is termed as neck region. Near the neck region, animal become thin, and at the tip, animal is a very thick part of the crown. After neck region, teeth embedded within the jawbone, and as the teeth enter inside the jawbone, it covered with the hard covering which is termed as cement. After cement, there is fibrous membrane is present which is termed as fibers of periodontal membrane. This periodontal membrane helps to attach the teeth with the jawbone, and it is present in between the cement and the jawbone. At the ending of the teeth, sensory nerve and blood vessels enter inside the teeth, and here is the blood vessel and sensory nerve ending is present. This is the basic structure of the teeth of human. These teeth help in the mechanical digestion of the food. Because of mechanical digestion, chemical digestion can take place efficiently within the oral cavity. Mechanical digestion helps to break down the food in the smaller pieces, due to which saliva mix well with the food, which help in the chemical digestion of the food, and food convert into the form of bolus that can be engulfed through the pharynx inside the digestive system of man. If the food is not break down into simpler pieces or small pieces, then it is very hard to engulf through the pharynx inside the esophagus. So, teeth play an important role in the digestion. So, it is important to take care of the teeth and prevent it from the various diseases. There are various diseases that are associated with the teeth, includes periodontal disease as well as dental caries. What is periodontal disease? Periodontal disease is caused due to the plaque. Plaque is the mixture of food, saliva and bacteria, in the result of which inflammation is caused on the teeth and gums. If this inflammation reaches to the periodontal membrane, then pain caused to the patient, in the result of which tooth may decay or toothache may be suffered to the patient. This is termed as periodontal disease. The second disease is the dental caries that is caused because of the calculus. When the food particles hold in between the cracks of the teeth, or trap between the cracks of the teeth, and the result of which plaque is formed. And that plaque, when mixed with the chemical composition of the saliva, then it is converted into the hard structure which is termed as calculus, which cannot be removed through brushing. When calculus is start to form on the teeth, in the result of which bacteria feed on the sugary material of the food and produce acid. This acid start to destroy enamel layer of the teeth and form a cavity that is termed as dental caries. This dental caries, if not treated earlierly, then it is reached to the dentine and pulp region, where the patient suffers with the dental ache as well as tooth becomes decay or fall off. To prevent from dental caries and plaque, we have to brush daily as well as increase the components of the fluoride inside the drinking water or food stuff like milk. These dental caries depends on the various factors, include disturbance in the salivary composition, lack of fluoride, lack of hygiene, as well as because of exposure to sugary food materials. So, to prevent from these diseases, we have to cut down from the sugary food materials as well as we have to brush daily and increase fluoride in our daily intake. I hope you got an idea about how can we prevent our teeth from the different diseases. In the next lecture, I will explain you about the other events of the holozoic nutrition, that are digestion and absorption.